This is CGTN, China Global Television Network.
Welcome to UN Insider. I'm Elaine Reyes at the Pan American Health Organization in Washington, D.C. Join us for this special look at some of the world's most pressing health issues and learn how the people inside work toward a better future for everyone around the world.
Coming up on UN Insider.
I used to dream of the day when we would have a safe and effective vaccine against malaria. Now we have two.
Working to bring an end to several epidemics. Are we getting closer to eradicating diseases like malaria?
We have a pandemic like COVID-19, and we know that we will have a new one in the future. We don't know when, we don't know the severity, but we know that this will happen again.
Preparing for a future pandemic. Is the world ready for the next global health challenge? Water everywhere, but not enough fit to drink. How technology and international cooperation are providing solutions to a drinking water dilemma. Next.
Good health and well-being is goal number 3 of the UN's 17 Sustainable Development Goals. Our health impacts so much of our daily lives, and it is more important than ever as the world emerges from the COVID-19 pandemic. But COVID isn't the only issue the UN's health organizations are dealing with. The SDGs include pledges to end the AIDS epidemic and stamp out other communicable diseases like tuberculosis by 2030. TB is preventable, but it killed more than 1 million people in 2021. During September's General Assembly session, world leaders approved a political declaration that includes ambitious new targets to fight tuberculosis. It calls for licensing at least one new vaccine in the next 5 years. And the WHO has launched a TB vaccine accelerator. Tropical diseases are also a concern. The UN wants to eradicate malaria by 2030, and a new vaccine could bring the world closer to that goal. Wilkester Nyabwa has the details.
2 years after the World Health Organization endorsed the first malaria vaccine, the World Health Body has authorized yet another one.
As a malaria researcher, I used to dream of the day when we would have a safe and effective vaccine against malaria. Now we have two.
The UK's Oxford University developed the R21 Matrix M vaccine with help from the Serum Institute of India. Scientists say this could be a turning point in the fight against malaria in Africa. Every year, the world registers over 200 million malaria cases and about 600,000 deaths. Most of these occur in Africa.
The majority of those are occurring in children under the age of 5 in sub-Saharan Africa.
Professor Azra Ghani's team at Imperial College London was involved in assessing the impact of the new drug.
One of the challenges has been the supply of that particular vaccine. So having a second vaccine available with similarly high efficacy, but also that has available supply and is priced at a level that makes it a cost-effective intervention, is really going to have a dramatic impact in sub-Saharan Africa.
They say RT21 can be produced for as little as $2 to $4 per dose. This makes it more affordable than the first malaria vaccine. That vaccine, called RTS-S and marketed as Mosquirix, was launched in 2021. In studies, it was considered to be about 30% effective. Research suggests that the new vaccine is more than 75% effective and that protection is maintained for at least another year with a booster. WHO experts, however, say the data does not show which vaccine is more effective just yet. India's Serum Institute says it can make up to 200 million doses of the new Oxford malaria vaccine a year.
We estimate that if this is rolled out across the continent at the sort of coverage levels that we've seen in the implementation studies so far, this could avert up to a third of malaria deaths in children under 5.
Regulatory authorities in Ghana and Burkina Faso have already approved the new malaria vaccine for use. Wilkis Anyabwa, CGTN.
Dengue fever has long been a health threat in parts of Asia and Latin America, but cases are expected to spread to other regions. The WHO's chief scientist says the illness could become a major problem in parts of Africa, Europe, and the U.S. within a decade. Climate change is creating conditions that allow the mosquitoes that spread the disease to thrive. An outbreak in Bangladesh has claimed more than 1,000 lives, and Peru has seen an alarming surge in cases. Dan Collins reports.
Peru is just one of the countries in South America facing a dengue epidemic as cases peak around the world. A perfect storm of hotter and wetter climatic conditions has helped mosquitoes, which spread the disease, multiply faster. The conditions have also helped the virus multiply within the insects' bodies. That has triggered a record peak in dengue cases in Peru and historic highs across South America.
I have just vomited blood. I have body pains, intense fever and chills, muscle pain. I have been like this for 2 days now.
The World Health Organization says half the population of the world is now at risk from the virus, impacting some 129 countries. While the number of cases of the disease, fatal in fewer than 1% of them, has exploded.
If you really look at the picture of the trends, in 2000 we had about 500,000 cases, and today in 2022 we recorded over 4.2 million cases, which really shows an 8-fold increase. And actually this can be much higher as we get more and more accurate figures.
The trend for dengue in 2023 is on track for 4 million plus. Cases registered by the WHO hit an all-time high in 2019 with 5.2 million cases. Beyond climate change, the WHO says other factors, including the increased movement of goods and people, more urbanization and poor sanitation, are also fueling the increase in cases. Dan Collins, CGTN, Lima.
The UN's Sustainable Development Goals aim to provide access to affordable medicine and vaccines for all and achieve universal health coverage. The Pan American Health Organization works towards those goals throughout the Americas. I sat down with Director Dr. Jarbas Barbosa. Dr. Barbosa, you're new to your role here at PAHO, but you've been within the organization for many, many years, most recently leading COVID vaccination efforts and access across the region. Looking ahead to the future, what is your vision for PAHO?
I think that one of the most important failures that we had was the lack of equitable access to vaccines. We need to guarantee that the countries will come together to establish a global mechanism to ensure equitable access. But there is a second action that we need to implement in Latin America and the Caribbean, that is to strengthen our capacity to produce vaccines, medicines, ventilators, and the personal protective equipment. So following the recommendations approved by our member state, PAHO is supporting and leading one regional platform to strengthen the local capacity that we already have in Latin America and the Caribbean, and it will be crucial to respond to a future pandemic.
What would you say are the biggest challenges that still remain in achieving some of those goals?
The most important challenge is to achieve consensus, because we are talking about the complex issues, political, diplomatic. So it has been a very, very intensive period of discussions. We are trying to support all our member states, including the small island development states, to participate in this debate, because I do believe this is a unique opportunity. If we don't get a good consensus in 2024, unfortunately, we will need to wait for the new public health crisis, for the new pandemic. For the second, we need to work with the countries strengthen their capacities, regulatory capacities, to strengthen the public and private initiatives that are already in place in the region in order to have a sustainable development of the local capacity.
And all of that being said, do you feel confident that all of that would help PAHO handle or address the next pandemic, whatever that is?
Many important steps have already been adopted. For instance, genomic surveillance in the region now, we have a network of 25 countries in Latin America and the Caribbean performing genomic surveillance. This was a huge effort and a very important achievement. But we need to do more. We need to strengthen laboratory capacity, integration with health services, including primary health care, that for many diseases is the first line of detection.
What are some of the biggest health concerns right now across the region?
The region has a very complex epidemiological scenario because at the same time we have communicable diseases that still persist, like TB, HIV, the outbreaks in the region like dengue fever, Zika and chikungunya. At the same time, we have a very important burden of non-communicable diseases that now are responsible for 82% of the total deaths in the region, and 30% of them are preventable and premature. We have at the same time the impact of climate change in many countries, in vector-borne diseases, and also violence and accidents. In some sub-regions of the Americas, in Central America, for instance, the homicide rate is similar to the countries that are in internal wars. So it's for this complex, very complex scenario, we need to build resilient health systems. We need to strengthen primary health care because primary health care is closer to the communities, can provide the first response, can provide the access for the vulnerable populations.
When it comes to climate change, we have seen the hottest year on record so far, July and September, the hottest months. How much of it is actually preventable?
Yes, health sector needs to be much more active in calling the attention of the society about the negative impacts provided by climate change, like the destruction of health facilities during extreme events, like hurricanes. At the same time, we have the situation related to vector-borne diseases, that this year we had the largest number of dengue fever recorded in history in Latin America, 30.5 million cases. So this is another example. And we also have food insecurity, because in many countries in Central America, for instance, the drought is completely devastation, is producing a complete devastation on agricultural production.
Looking across at the future of healthcare, of access, of availability, are you optimistic that now that the world is starting to recover, as you mentioned, from the pandemic, are you hopeful that everyone is moving in the right direction?
You know that we always hope for the best, but we also need to be very realistic about the challenge that we have. The pandemic showed us that nobody was really prepared to face a pandemic with the characteristics of COVID-19. We learned a lot of lessons during the pandemic, but we still needed to call the attention of the economic sector, the financial institutions, that health needs to be part and in the center of the development agenda. That without health and without a resilient health system, no economy is protected when we have a pandemic like COVID-19. And we know that we will have a new one in the future. We don't know when, we don't know the severity, but we know that this will happen again because we had the SARS, MERS, flu H1N1 in the past, so probably we will have a new one in the near future, and you need to be much better prepared. So this is one thing that is very important. The second is that to translate the attention that the health sector got during the pandemic into concrete actions to strengthen the systems, to have more resilient health systems and to remove barriers to guarantee that we are really implementing universal health in the region.
Dr. Barbosa, thank you so much for your time. We appreciate you joining us.
I thank you for inviting me to be here.
Coming up.
I don't think race played a factor with the first diagnosis, but within my treatment care, yes.
UN Insider.
Sri Lanka is surrounded by water, yet parts of the island nation have long had a shortage of clean drinking water. That's also led to serious health implications. Uja Shin shows us how an international program is tackling the issue.
Our story begins with water. Known as the teardrop of the Indian Ocean, Sri Lanka is especially sensitive to climate change. The decrease in precipitation has left parts of the country short of the key resource for years.
This is Sri Lanka's longest river, Mahaveli Ganga. The color of the river simply tells us there's a long way to go from river water like this to drinkable water. But a few years ago, due to the lack of water purification technology, villagers in remote areas in central Sri Lanka simply filtered the surface water river like this and drank it directly. And that makes Sri Lanka a country with a high incidence of chronic kidney disease of unknown etiology.
In the areas of Sri Lanka with a high rate of chronic kidney disease of this kind, 1 in every 5 people are sufferers. Most of the patients are breadwinners for their families, typically males aged 30 to 60. After falling ill, they often lose the ability to work and are burdened by high medical expenses.
We had about recorded 50,000 around patients. Most of the hypotheses we got focusing about drinking water. By that time, we didn't have technology to make sure water is safe for public consumption.
Between 2008 to 2015, we were in a very critical stage. So during that period, we need some external assistance to overcome those problems. We had some discussions with the Chinese government.
China accepted Sri Lanka's request for help. In 2015, witnessed by the presidents of both sides, the two countries formally launched cooperation in water purification and research. A 70-person team from the Chinese Academy of Sciences has since become the technical core of the project.
After investigating the local groundwater, we found the water was hard and high in fluoride. Through research and experiments on mice and rats, it's been proven the water is closely related to kidney disease. In response, we've developed technologies such as electrodialysis, nanofiltration, and other methods, which can remove high concentrations of harmful particles of chlorine and calcium and turn it into clean drinking water.
To date, Chinese scientists have helped to solve the drinking water problem for more than 5,000 people in central and northern Sri Lanka. This building, the China-Sri Lanka Joint Water Technology Research and Demonstration Center on the campus of the University of Preparedness, is also teaching a program in water studies. The idea is that teaching someone to fish, instead of simply giving them one, solves problems over the long term.
This is not only from University of Preparedness. We have made awareness programs to other universities in Sri Lanka and also to the other research institutes in Sri Lanka. So they are sending us a group of students, and a lot of volunteers are also here.
Traveling between Beijing, China and Kandy, Sri Lanka has become routine for Wang Yawei and others. On the way back, he tells us that before doing anything, he asks himself about the significance. And he says providing water purification technology to Sri Lanka fills him with a strong sense of honor. Quoting Wang's words, our story also ends with water. Just as each droplet gathers to help form the ocean, he says the efforts of each individual contribute to bilateral ties between China and Sri Lanka, turning a teardrop on the Indian Ocean into one of hope. 刘嘉欣 CGTN Candy.
Everyone needs healthcare, but inequalities can make it difficult to get proper treatment. Economic levels, gender, and race can play a role in the care that patients receive. A recent study illustrates racial disparities in breast cancer treatment. Nitza Soledad Perez has the story.
I'm just loving on me right now. I really am. I had my last chemo last week, Friday. So I kind of told the oncologist, I need a break. You know, I need to love my scars because I had a double mastectomy.
Tracy was diagnosed with invasive ductal carcinoma, stage 3 cancer, an aggressive type that spreads fast in her right breast. Although national headlines celebrate how cancer death rates have come down, racial disparities in diagnosis, treatments, and outcomes have not.
Black women are 40% more likely to die of breast cancer than white women, and they're also twice as likely to die from the disease if they're over 50 years old, according to the American Cancer Society.
I don't think race played a factor with the first diagnosis, but within my treatment care, yes.
And can I listen to your heart?
When you see your oncologist, you have to be able to have that dialogue, that community. You have to feel comfortable. When there's a break, there could be a break in you. So, and that's what had happened to me.
According to studies, some minority patients do not always feel comfortable or understood by a white male doctor. And some doctors might also feel less comfortable attending to minority patients.
I personally think the most important thing that we need to do is to diversify the workforce. There is still a huge gap of representation of Black doctors. Black people make up 13% of the population, but it's a very little percentage of the doctors that are practicing medicine.
But diversity won't be easily achieved. Since 2021, about 64% of practicing physicians were white, almost 21% were Asian, close to 7% were Hispanic, and nearly 6% identified as Black. Another option is improving racial and cultural training in the medical field.
And providers that need to be trained in both cultural competence, in implicit bias, in anti-racism, and really have a good core amount of information there and train to be able to recognize their own biases so they're able to interact with the patients better.
According to a panel of experts that recently gathered in South Florida, the cultural and racial gap also stops Black patients from undergoing preventive care.
There has been studies that show that if we have patients who have BRCA mutations where we want them to potentially do risk-reduced mastectomy or having their ovaries out, our patients of color aren't doing that at the same levels. And good possibility here is the fact that we have that missing cultural competence, that they are quite hearing that is what they need to do because they don't feel they're being listened to.
As for Tracy, she also pleads to be listened to.
I need to love on me before you decide to want to give me more medicine. Before you decide not to hear me when I tell you, let's try something different. Let's try alternative, because I don't take medicine, but I took the medicine to help cure if there was any cancer left. You understand? So right now, I'm just loving on me.
Nitza Soledad Perez, CGTN, Miami.
UN Insider.
All you need to know about China. China 24, only on CGTN. Whether it's about your education, the home you live in, or the items you buy, your money has a story to tell. Because every business story is a human story. Global Business.
Every November, the UN marks World Children's Day. Concern for the health and well-being of our younger generations helped inspire the event. We asked some young musicians to share their thoughts about the healing power of their art.
I think music can heal the hate in this world.
I'm Canadian, but my background is fully Bangladeshi. Peace to me means to be able to trust and respect the people that you love, to be able to live without worry, and to live without conflict. I hope that one day the world can understand what that means, what peace means.
It's also to train their hearts. And if they use their music the right way, maybe we will end up having peace in the world one day.
I'm Elaine Reyes of the UN's Pan American Health Organization in Washington, D.C. Thanks for being a UN Insider. Welcome to UN Insider. I'm Elaine Reyes at the United Nations headquarters in New York.
I'm sure this program will open up a new window for the audience to learn more about the UN, about multilateral diplomacy, and about China's role on the international stage.
We should develop a consensus around dialogue. Wars are destructive. Wars don't solve problems.
There is no action that is good enough for the planet if it is not good for the people.
Every day across the world, we are supporting countries in realizing their national development aspirations.
Congratulations on launching the UN Insider. It's an important program because it brings the United Nations to the people.
I would like to convey my salutations to UN Insider. I think it's very important for all the population in the world to understand what is happening within the UN.
I sat down with David Torres.
And I do hope that this new show will make more people know more about the United Nations.
Bold, unprecedented action must follow.
Inclusion is such an important dimension of the philosophy of the United Nations and of the General Assembly.
Congratulations for all the people who are producing this UN Insider.
China is one of the most important financial contributors to peacekeeping.
Yo quiero destacar la importancia de un programa clave que es UN Insider. Los invito a ver este programa que trata sobre todo lo relacionado con las Naciones Unidas.
UN Insider, I hope, will be successful, and it will highlight the importance of multilateralism and what is going on, and shed light on the various aspects that are associated with this international community and how it operates.
UN Insider is a wonderful initiative. In the UN, we are 193 nations that gather together here and discuss and try to find solutions for all of the problems of mankind.